What is a cold? The common cold is a viral infection of your nose and throat, upper respiratory tract. It's usually harmless, although it might not feel that way. Many types of viruses can cause a common cold. Children younger than 6 are at greatest risk of colds, but healthy adults can also expect to have 2 or 3 colds annually. Most people recover from a common cold in a week or 10 days. Symptoms might last longer in people who smoke. If symptoms don't improve, you have to see a doctor. Symptoms, well, there are several symptoms. For example, runny or stuffy nose, sore throat, cold, congestion, a slight body aches or a mild head or headache, sneezing, low-grade fever, generally feeling unwell. The symptoms of common cold usually appear 1 to 3 days after exposure to a cold-causing virus. Signs and symptoms, which can vary from person to person. Causes. Although many types of viruses can cause a common cold, rhinoviruses are the most common culprit. A cold virus enters your body through your mouth, eyes or nose. The virus can spread through droplets in the air when someone who is sick coughs, sneezes or talks. It is also spread by hand-to-hand contact with someone who has a cold or by sharing contaminated objects such as utensils, towels, toys or telephones. If you touch your eyes, nose or mouth after such contact or exposure, you are likely to catch a cold. Risk factors that can increase your chances of getting a cold can be the age, also smoking. If you are more likely to catch a cold and to have more severe colds if you are exposed to cigarette smoke. Weakened immune system can be another risk factor. Having a chronic illness or otherwise weakened immune system increases your risk. Time of year. Both children and adults are more susceptible to colds in fall and winter, but you can get a cold anytime. Exposure. If you are around many people, such as at school or an airplane, you are likely to be exposed to viruses that cause colds. Prevention. There is no vaccine for the common cold, but you can take common sense precautions to slow the spread of cold viruses. Wash your hands. Clean your hands thoroughly and often with soap and water, and teach your brothers or children the importance of hand washing. Disinfect your stuff. Also, you have to use tissues and take care of yourself, eating well, getting exercise and enough sleep. Managing stress might help you keep colds at bay. Steer clear of colds, avoid close contact with anyone who has a cold. Don't share drinking glasses or utensils with another family member. Use your own glass or your own cups. Well, that's all. What are cuts or scratches? Cuts and scratches are areas of the match on the surface of the skin. A cut is a line of the match that can go through the skin and into the muscles tissues below. Cuts and scratches might bleed or turn red, become infected and leave scars. What are the symptoms of cuts and scratches? The symptoms of cuts and scratches include bleeding, redness or swelling around the wound, pain or irritation in the skin surface. What are the risk factors for cuts? Cuts can happen to anyone. People are more likely to get cuts if they are in a combative situation or if they handle sharp objects. Scratches are usually accidental. Children are more susceptible to cuts and scratches than adults because they are more active and have less control over their growing bodies. What causes cuts? A cut is usually the result of an encounter with a sharp object, such as knife or razor blade. Objects with thin edges, like a piece of paper or a thin cardboard box, can also create cuts if not handled carefully. The scratch may be caused by an encounter with an abrasive surface, such as sandpaper, unfinished wood, or concrete. Wounds inflicted by animals, such as those caused by cats, are often classified as scratches. How are cuts diagnosed? A cut or scratch can usually be diagnosed through visual inspection. Some small cuts, like paper cuts, require sharp eyes or magnifying glasses to see. How we have to treat cuts? There are several ways to treat cuts and scratches depending on their severity. If the skin is kept clean, many cuts and scratches heal on their own. To accelerate that healing process, patients can choose from the following methods. Medication. Over-the-counter and prescription medications are available for wound care. Antibiotic ointment can prevent infection or a cut or a scratch. Pain relievers may reduce irritation and control inflammation around the wound, and some topical creams may be prescribed to prevent swelling. Surgery. If a cut results in a large open wound, it may require stitches in order to heal. If the cut becomes infected beyond repair, the area of infection may have to be removed. Home care. Applying pressures to the cut or scratch can stop the bleeding. Covering the wound with a bandage will keep it clean and allow for direct application of antibiotic ointment. The bandage will also absorb any blood that remains as the wound heals. Before the bandage is applied, the wound should be cleaned with water, ethyl alcohol or hydrogen peroxide. We can use alternative therapies. A tetanus booster shot is sometimes recommended after a cut. How we prevent cuts? To prevent cuts, avoid dangerous activities and interactions with sharp or coarse surface. Wear clothing to protect your arms, legs and core, and be aware of your environment. If you do get a cut or scratch, clean and treat it immediately to prevent infections. And take away, because cuts are part of every life, especially for children. Well, that's all. Thank you. What is depression? Depression is classified as a mood disorder. It may be described as feeling of sadness, loss, or anger that interfere with a person's everyday activities. It's also people experience depression in different ways. It may interfere with your daily work, resulting in lost time and lower productivity. It also can influence in relationships and some chronic health conditions. The conditions that can get worse due to depression include arthritis, asthma, cardiovascular disease, cancer, diabetes, obesity. It's important to realize that feeling down at times is a normal part of life. Sad and upsetting events happen to everyone, but if you are feeling miserable or hopeless on a regular basis, you could be dealing with depression. Depression is considered a serious medical condition, and it can get worse without proper treatment. Yet those who seek treatment often see improvements in symptoms in just a few weeks. Depression symptoms. Depression can be more than a constant state of sadness or feeling blue. Major depression can cause variety of symptoms. Some affect your mood, and others affect your body. Symptoms might also be ongoing or come and go. Depression can affect men, women, and children differently. The symptoms of depression in men may include mood, anger, aggressiveness, irritability, anxiousness, restlessness. In the emotional part, feeling empty, sad, hopeless. In their behavior, loss of interest, no longer feeling pleasure in their favorite activities, feeling tired easily, thoughts of suicide, drinking excessively, using drugs. In the sexual life, the sexual desire is reduced. They also can have insomnia, restless sleep, excessive of sleepiness. In the physical part, pains, headaches, digestive problems. The symptoms on women may include irritability in the mood part, emotional, feeling sad or empty, hopeless. In their behavior, loss of interest in activities, withdrawing from social engagements, thought of suicide. In the cognitive part, thinking of taking more slowly. They have difficulty sleeping through the night or sleeping too much. In the physical part, they have decreased energy, greater fatigue, change in appetite, weight changes, pain, and more. The depression causes. There are several possible causes of depression. They can range from biological to circumstantial. Common causes include family history. You are at a higher risk for developing depression if you have a family history of depression or another mood disorder. Early childhood trauma. Some events impact the way that body reacts to fear and stressful situations. Brain structure. There's a greater risk for depression if the frontal lobe of your brain is less active. However, scientists don't know if this happens before or after the onset of depressive symptoms. Also, medical condition or use of drugs. Thank you. Diarrhea is characterized by loose, watery stools of a frequent need to have a bowel movement. It usually lasts a few days and often disappears without any treatment. Diarrhea can be acute or chronic. Acute diarrhea occurs when the condition lasts for 1 to 2 days. You might experience diarrhea as a result of a viral or bacterial infection. Other times, it could be due to food poisoning. There's even a condition known as traveler's diarrhea, which happens when you have diarrhea after being exposed to bacteria or parasites while on vacation in a developing nation. Acute diarrhea is fairly common. Chronic diarrhea refers to diarrhea that lasts for at least 4 weeks. It's usually the result of an intestinal disease or disorder such as Crohn's disease, for example. What causes diarrhea? You may experience diarrhea as a result of a number of conditions or circumstances. Potential causes of diarrhea include a food intolerance, such as lactose intolerance, a food allergy, an adverse reaction to a medication, a viral infection, a bacterial infection, an intestinal disease, a parasitic infection, or stomach surgery, for example. What are the symptoms of diarrhea? There are many symptoms of diarrhea. You may experience only one of these or any combination of all of them. The symptoms depend on the cause. It's common to feel one or more of the following: nausea, abdominal pain, bloating, a fever, bloody stools, cramping, a frequent urge to evacuate your bowels, a large volume of stools. The dehydration and diarrhea. Diarrhea can cause you to lose fluids quickly and put you at risk for dehydration. If you don't receive treatment for diarrhea, it can have very serious effects. The symptoms of dehydration include fatigue, dry mucous membranes, increased heart rate, a headache, increased thirst, decreased urination, dry mouth, for example. How is the cause of diarrhea diagnosed? Your doctor will complete a physical examination and consider your medical history when determining the cause of your diarrhea. They may also request laboratory tests to examine urine and blood samples. And the treatment for diarrhea usually requires replacing lost fluids. This simply means you need to drink more water or electrolyte replacement beverage, such as sports drinks. In more serious cases, you might get fluids through intravenous therapy. If a bacterial infection is the cause of your diarrhea, your doctor may prescribe antibiotics. How can I prevent diarrhea? You can avoid developing diarrhea from food poisoning by washing the cooking and food preparation areas more frequently. Serve food immediately after preparing it. Refrigerate leftovers promptly, and always throw frozen food in a refrigerator. Well, that's all. Thank you. Dry skin is an uncomfortable condition marked by scalding, itching, and cracking. It can occur for a variety of reasons. You might have naturally dry skin, but even if your skin tends to be oily, you can develop dry skin from time to time. Dry skin can affect any part of your body. It commonly affects hands, arms, and legs. In many cases, lifestyle changes and over-the-counter moisturizers might be all you need to treat it. If those treatments aren't enough, you should contact your doctor. Types of dry skin. Exposure to dry weather conditions, hot water, and certain chemicals can cause your skin to dry out. Dry skin can also result from underlying medical conditions. Dermatitis is the medical term of extremely dry skin. There are several different types of dermatitis. Contact dermatitis develops when your skin reacts to something it touches, causing localized inflammation. Irritant contact dermatitis can occur when your skin is exposed to an irritating chemical agent, such as bleach. Seborrheic dermatitis occurs when your skin produces too much oil. It results in a red and scaly rash, usually on your scalp. This type of dermatitis is common in infants. Atopic dermatitis is also known as eczema. It's a chronic skin condition that causes dry scaly patches to appear on your skin. It's common among young children. Risk factors for dry skin. Dry skin can affect anyone, but some risk factors raise your chances of developing dry skin, including the age. Older adults are more likely to develop dry skin. As you age, your pores naturally produce less oil, raising your risk of dry skin. Medical history. You are more likely to experience dry skin or allergic contact dermatitis if you have a history of this condition or other allergic diseases in your family. The season. Dry skin is more common during the fall and winter months when humidity levels are relatively low. In the summer, higher levels of humidity help stop your skin from drying out. Bathing habits. Taking frequent baths or washing with very hot water raises your risk of dry skin. Treatment for dry skin. Lifestyle remedies. Simple lifestyle changes can help prevent and relieve dry skin. Try to avoid using hot water to shower. Shower every other day instead of every day. Keep your shower time to less than 10 minutes. Use a moisturizing soap when you are showering. Apply moisturizer immediately after bathing or showering. Avoid itching or scrubbing dry skin patches. Use a humidifier in your home. It's also important to choose the right kind of moisturizer for your skin type. If your skin is extremely dry, look for a petrolatum-based product. You might consider switching to a lighter water-based lotion during the summer months if your skin becomes less dry. Then, lotions that contain grapeseed oil and antioxidants can also help trap water in your skin. Well, that's all. Thank you. What is an earache? Earache usually occurs in children, but they can occur in adults as well. An earache may affect one or both ears, but the majority of the time it's in one ear. It may be a constant or come and go, and the pain may be dull, sharp, or burning. If you have an ear infection, fever, and temporary hearing loss may occur. Young children who have ear infections tend to be fussy and irritable. They may also tug or rub their ears. The symptoms that can develop earache include ear pain, impaired hearing, fluid drainage from ear. In children, there are different symptoms like fever, sense of fullness in the ear, difficulty sleeping, crying or acting irritable more than usual, headache, loss of appetite, loss of balance, ear pain, obviously. What are the common causes of earaches? Earaches: injury, infection, irritation in the ear, or referred pain may cause earaches. Referred pain is pain felt somewhere other than the infection or injured site. For example, pain that originates in the jaw or teeth may be felt in the ear. Causes of earaches can include ear infections, are a common cause of earaches or ear pain. Ear infections can occur in the middle and inner ear or outer. The other ear infection can be caused by swimming, wearing hearing aids or headphones that damage the skin inside the ear canal, or putting cotton swabs or fingers in the ear canal. In the middle ear area, the infection can be caused by infections that stem from a respiratory tract infection. Fluid built up behind the ear drums caused by this infection can breed bacteria. Labyrinthitis is an inner ear disorder that's sometimes caused by viral or bacterial infections from respiratory illnesses. Other common causes of earaches can be change in pressure, such as when flying on a plane, earwax build up, a foreign object in the ear, sinus infection, shampoo or water trapped in the ear, use of cotton swabs in the ear, perforated eardrum, arthritis affecting the jaw, infected tooth, impacted tooth. Less common causes of earaches can be eczema in the ear canal, trigeminal neuralgia. How treat the earaches at home? You can take several steps at home to reduce ear pain. For example, apply a cold washcloth to the ear. Avoid getting the ear wet. Sit upright to help relieve ear pressure. Use over-the-counter ear drops. Feed an infant to help them relieve their pressures. Well, how to prevent earaches? Avoid the smoking and exposure to a second-hand smoke. Keep foreign objects out of the ear. Dry the ear after swimming or bathing. Avoid allergies, triggers such as pollen or dust. That's all. Fever is also known as hyperthermia or elevated temperature. It describes a body temperature that's higher than normal. Fever can affect children and adults. A short-term increase in body temperature can help your body fight off illness. However, a severe fever can be a symptom of a serious condition that requires immediate medical attention. How to recognize a fever? Normally, body temperature is typically around 37 centigrades. However, the normal body temperature for each person can vary slightly. Normal body temperature may also fluctuate depending on the time of the day. It tends to be lower in the morning and higher in the late afternoon and evening. What usually causes a fever? Fever occurs when a part of the brain called the hypothalamus shifts the set point of your normal body temperature upward. When this happens, you may feel chilled and add layers of clothing on you may start shivering to generate more body heat. This eventually results in a higher body temperature. There are many different conditions that can trigger a fever. Some possible causes include infections, including the flu, some immunizations such as tetanus or diphtheria, also blood clots, extreme sunburn, food poisoning, some inflammatory diseases including the Crohn's disease, some medication including antibiotics. Depending on the cause of the fever, additional symptoms may include sweating, shivering, headache, muscles ache, loss of appetite, dehydration, general weakness. How to treat a fever at home? Care for a fever depends on its severity. A low-grade fever with no other symptoms doesn't typically require medical treatment. Drinking fluids and resting in bed are usually enough to fight off a fever. When a fever is accompanied by mild symptoms such as general discomfort or dehydration, it can be helpful to treat elevated body temperature by making sure the room temperature where the person is resting is comfortable, taking a regular bath or a sponge bath using lukewarm water, drinking plenty of fluids. When is a fever a medical emergency? Go to the nearest emergency room. If you have confusion, inability to walk, trouble breathing, chest pain, hallucinations, for example. How to prevent a fever? Wash your hands often, especially before eating, after using the toilet, and after being around large numbers of people. Show your children how to wash their hands properly. To prevent, also you can carry hand sanitizer or antibacterial wipes with you. Avoid touching your nose, mouth or eyes. Doing so makes it easier for viruses and bacteria to enter your body and cause infection. Cover your mouth when you cough and your nose when you sneeze. Avoid sharing cups, glasses and eating utensils with other people. Well, that's all for this video. What is a fracture? A fracture is a broken bone. It can range from a thin crack to a complete break. Bone can fracture crosswise, lengthwise in several places, or into many pieces. Most fractures happen when a bone is impacted by more force or pressure than it can support. What are the symptoms of a fracture? Most fractures are accompanied by intense pain when the initial injury occurs. It may become worse when you move or touch the injured area. In some cases, you may even pass out from the pain. You may also feel dizzy or chilled from shock. Other potential symptoms of a fracture include a snap or grinding sounds when the injury occurs, swelling, redness and bruising in the injured area, difficulty supporting weight with the injured area, visible deformity in the injured area. What are the different types of a fracture? Fracture can be classified as closed or open, as well as incomplete or complete. Closed and open. A closed fracture is also called a simple fracture. In a closed fracture, the broken bone doesn't break your skin. An open fracture is also called a compound fracture. In an open fracture, the ends of the broken bone tear your skin. When your bone and other internal tissues are exposed, it puts you at higher risk of infection. Incomplete and complete fracture. In an incomplete fracture, your bone doesn't break completely. In other words, it cracks without breaking all the way through. Types of incomplete fracture include hairline fracture, in which your bone is broken in a thin crack; green stick fracture, in which your bone is broken on one side while the other side is bent. Now I'm going to talk about complete fracture. Is when your bone breaks completely. It's snapped or crushed into two or more pieces. Types of complete fracture include the single fracture, in which your bone is broken in one place into two pieces; comminuted fracture, in which your bone is broken or crushed into three or more; compression fracture, in which your bone collapses under pressure; segmental fracture, in which your bone is broken in two places in a way that leaves at least one segment floating and unattached; displaced fracture, in which your bone breaks into pieces that move out of their normal alignment. What causes a fracture? You can develop a fracture when your bone is impacted with greater pressure or force than it can support. This force usually occurs suddenly or is very intense. The strength of the force determines the severity of the fracture. Some common causes of fractures include falls, direct strikes to your body, traumatic events such as a car accident or gunshot wounds, injuries from sports. How is at risk of a fracture? Anyone can be experiencing a fracture, but you are more likely to develop one if you have brittle bones or low bone density. You are more likely to develop brittle bones if you are older, if you have osteoporosis, if you are taking corticosteroids, if you drink alcohol, smoke, if you are physically inactive, have endocrine or intestinal disorders. Well, that's all. Thank you. A headache is a very common condition that causes pain and discomfort in the head, scalp or neck. It's estimated that 7 in 10 people have at least one headache each year. Headaches can sometimes be mild, but in many cases they can cause severe pain that makes it difficult to concentrate at work and perform other daily activities. In fact, 40% millions of persons in the United States frequently have severe head attacks that can be disabling. The primary causes of headaches are causes that aren't related to separate medical conditions. These headaches are the result of an underlying process in the brain. Examples of common primary headaches include migraine, cluster, and tension headaches. Secondary causes of headaches are those that are due to an underlying medical condition. Examples of secondary headaches causes include brain tumor or brain aneurysm. The presence of a brain tumor or brain aneurysms can lead to headache. This is because there is only so much room in the skull. When the skull starts to build up with blood or extra tissues, the compression on the brain can cause a headache. Another secondary causes is cervicogenic headaches. Occurs when disc starts to degenerate and press on the spinal column. The result can be significant neck pain as well as headaches. Medication overuse headaches is another cause of headache. If a person takes a significant amount of pain medications daily and starts to taper them or discontinue them altogether, a headache can result. Post-traumatic headaches. Sometimes a person will experience headaches after trauma to the head sustained during an event like a fall, car accident, or skiing accident. Sinus headaches. Inflammation in the normally air-filled sinus cavities in the face can cause pressure and pain that leads to a sinus headache. Well, the headaches types. Several different headaches types exist. Tension headaches are the most common type of headache and occur most frequently in women over age 20. These headaches are often described as feeling like a band around the head. They are caused by tightening of the muscles in the neck and scalp. Poor posture and stress are contributing factors. Cluster headaches. Are non-throbbing headaches that cause excruciating, burning pain on one side of the head or behind the eye. They usually cause the eyes to tear up and produce nasal congestion or rhinorrhea. Migraine headaches are severe headaches that can cause throbbing, pounding pain, usually on one side of the head. Several different types of migraine headache exist. This includes chronic migraines, which are migraines that occur 15 or more days a month. The rebound headaches are those that occur after a person stops taking medications they used regularly to treat headaches. Well, that's all for this video. During a heart attack, the blood supply that normally nourishes the heart with oxygen is cut off, and the heart muscles begins to die. Heart attacks, also called myocardial infarctions, are very common in different countries. In fact, it's estimated that one happens every 40 seconds. Some people who are having a heart attack have warning signs, while others show no signs. Some symptoms that many people report are chest pain, upper body pain, sweating, nausea, fatigue, trouble breathing. A heart attack is a serious medical emergency. Seek immediate medical attention if you or someone you know is experiencing symptoms that could signal a heart attack. Causes. There are a few cardiac conditions that can cause heart attacks. One of the most common causes is plaque buildup in the arteries that prevents blood from getting to the heart muscles. Heart attacks can also be caused by blood clots or a torn blood vessel. Less commonly, a heart attack is caused by a blood vessel spasm. The symptoms for heart attack may include chest pain or discomfort, nausea, fatigue, sweating. There are many more symptoms that can occur during a heart attack, and symptoms can differ between men and women. Risk factors. A number of factors can put you at risk for a heart attack. Some factors you can't change, such as age and family history. Other factors called modifiable factors are ones you can change. Risk factors that you can't change include age. If you are over age 65, your risk for having a heart attack is greater. Sex. Men are more at risk than women. Family history. If you have a family history of heart disease, high blood pressure, obesity, or diabetes, you are more at risk. Race. People of African descent have a higher risk. Risk that you can change include smoking, high cholesterol, obesity, lack of exercise, diet and alcohol, stress. Diagnosis. The diagnosis of a heart attack is made by a doctor after they perform a physical exam and review your medical history. They should also take a sample of your blood or perform other tests to see if there is evidence of heart muscles damage. Tests and treatments. The common are angioplasty, the stents, heart bypass surgery. In bypass surgery, your doctor reroutes the blood around the blockage. The pacemaker, heart valve surgery, heart transplants. A transplant is performed in several cases where the heart attack has caused by permanent tissues death to most of the heart. The doctor may also prescribe medication to treat your heart attack, including aspirin, drugs to break up clots, antiplatelets, and anticoagulants, also known as blood thinners, painkillers, nitroglycerin, blood pressure medication. Also, there are alternative treatments and lifestyle change can improve your heart health and reduce your risk of heart attack. A healthy diet and lifestyle are essential in maintaining a healthy heart.